Dr. Cole, thank you so much for coming.
Thank you for having
Would you
me.
please state your full name and date of birth?
Yes, my full name is Norman Moore Cole, and my date of birth is March 3, 1936.
Would you tell us your parents' name?
Yes, my father's name was William and my mother's name was Dorothy.
Okay. Any medical connection there?
None whatsoever. They had no medical background, and neither did any of my immediate family have any medical background whatsoever.
And you were born where?
Prairie City, Oregon, which is a small mining and logging town in eastern Oregon. It had about 2 family doctors within about the 30-mile radius, and I was delivered by one of them.
Now, how many children, grandchildren, great-grandchildren?
I have 5 children, and I have 8 grandchildren.
Where you trained, you did your plastic training in Durham, North
Yes, I
Carolina?
did my plastic training at Duke University under Dr. Kenneth Peck.
Yes, okay. What inspired you to go into plastic surgery?
I think the inspiration came during my general surgery training. I did my general surgery training in the Los Angeles County General Hospital, and it was the head and neck service and the burn service that inspired me to explore reconstructive surgery. I had no interest in doing anything other than reconstructive. Cosmetic surgery was not even on the horizon at that time. But the immense deformities that sometimes occurred at the end of these radical head and neck procedures, as well as the burns, made me say, well, what can be done to reconstruct these? And at that point in time at the LA County, there was no plastic surgeons and there was no reconstructive surgery. And it seemed to me like that was a very challenging and a very important thing to get into. And so that's what inspired me to explore plastic surgery. And I looked for the best plastic surgery residency there was in the country, and at that time it was Duke University.
Would you tell us a little bit about your mentors while you're on the subject of plastic surgery, or any mentors?
Mentor would be Dr. Kenneth Peck, who was chairman and professor of plastic surgery at Duke University. And he would be the one that I would point to as probably having more influence in my life than anyone else other than my father. I think everybody has an encounter with somebody that they single out that might have been the biggest impact, and he was for me. And he was a very unusual individual, and he trained scores of plastic surgeons and many program directors. Lots of his people became presidents of organizations, ASPRS, ASPS, the aesthetic side of it. It was an interesting group, and looking back, I said, how did that happen? Why was there such a concentration of people that seemed to achieve so much? And it wasn't the procedures he showed us. It wasn't the techniques that he showed us. It was the attitude that he transmitted. We all came to Duke as skilled surgeons. He didn't accept anybody that wasn't board certified or board eligible in surgery. So we had the tools to do it. Mm-hmm. And learning the procedures wasn't that difficult. But the attitude that he imparted, when I left, I was tremendously confident that there wasn't anything that I couldn't handle. There wasn't any defect that was too large that I couldn't cover. There was no challenge that was too great. And it was the attitude and conviction that people came out of that program, and it was him. Mm-hmm. And it wasn't the thing, it was non-surgical things that he taught us in terms of confidence and competence. And things that you won't read in books, and things that you won't find in the operating room if you don't listen, and things that you won't learn in the classroom. That's the most valuable thing that I ever came out of in any organization, and because of that man.
We've seen momentous paradigm shifts in our profession during your illustrious career. Just tell me a little bit about your thoughts about that. Good, bad,
well,
ugly.
I wouldn't characterize my career as illustrious, but nonetheless, I am a plastic surgeon that was in private practice, solo private practice. When I began private practice, aesthetic surgery was essentially in its infancy. The Aesthetic Society had been established only a couple of 2 or 3 years. And the most interesting thing to me in terms of the change in plastic surgery was the emergence of cosmetic surgery and the fact that it became something more than the red-headed stepchild of the specialty. the part of the specialty that those that were in academics did not even want to acknowledge, and that the ASPRS at the time did not accept papers to be presented at their meeting, and they would not accept papers to be published in PRS. And so the Aesthetic Society came into being. Well, that was just about the time that I was going into practice. And since that time, in the 40 years that have, or more, that have, almost 50 now, that it was to see that aesthetic surgery has not only been accepted, but it now becomes, in the mind of the public, sometimes the face of plastic surgery. And I think that's a shame to a degree, because I think that reconstruction should be the primary part of plastic surgery. It's the part that it attracted me. And to me, that reconstructive surgery, the pendulum has swung a little bit too far. Too many people are leaving their reconstructive skills behind and going into primarily cosmetic surgery. And cosmetic surgery just does not require the skill set that it does for reconstruction. So I think it's a shame that the tenor of the practice has moved into an area where I think people are leaving a lot of really good skills and talents behind.
What do you think has been the most important innovation of our specialty?
I don't know of any specific innovation. I think that the one thing that drives innovation is technology. And I think that we are being increasingly exposed in medicine in general to technology that is changing the whole fabric of how we do it, particularly in surgery. Example, cardiothoracic surgeons. I mean, that was 8 or 10 years of training. And they did coronary bypasses and opened up chests, and they were kind of the top dog in surgery. And along comes an interventional radiologist with no surgical training or skills at all, and they can go in and place stents that it would take an open heart to replace before. I mean, that is technology that has absolutely changed the whole dynamics of cardiothoracic. You still need cardiothoracic surgeons. Injuries, procedures that don't go well, you're always going to need cardiothoracic surgery.
Right.
But right now, in most instances, the procedure is better done by an interventional radiologist. That's a technology change that is profound. And then you go further, and it happened in plastic surgery as well, the endoscopic. Introduction to endoscopics. I had to learn how to do endoscopic surgery if I were going to do transaxillary augmentations. And it was strange, because here I was, if I needed more skills in video gaming to be successful in what I was doing, I was looking at a screen, it was someplace off, and my instrument was down there. And yet on the other hand, things were magnified to a point where I could have never seen them as well looking through an incision. But I learned how to do surgery by manipulation rather than cutting and sewing, those type of things. That's what the biggest innovations, not necessarily peculiar to plastic surgery, but peculiar to all of medicine and surgery, is going to be the advancing of technology, whereby many of the things that we assume have to be done surgically will be able to be done in conjunction with computers, and may be done better. It may be that at one point in time, we're going to go into an operating room and with a computer or a disk or a thumb drive that will be peculiar to that patient based on various scans, so on and so forth, and it'll be plugged in, and much of the surgery that we do is going to be directed by the computer that we're working with, even to the point of some robotics. It's a fascinating thing to think about. It won't affect me, but I think it's going to affect any person that's going into plastic surgery at the present time. Changes in plastic surgery are going to occur with technology that we hardly are able to imagine. And it may be, and come on, go out 30 years. I can remember the changes that occurred in my 30 years. I never imagined a face transplant. Many of the things that occurred during just the 30 years that I was in practice has had remarkable impact that I would have never imagined. Now, that's only going to be exponential. with the increasing amount of computerization and even with microsurgery, I think microsurgery is going to be the point where the microsurgeon will be doing a lot of it by manipulating into areas where devices go into that could never have been imagined even by microsurgery looking through a microscope. These are things that I think are exciting, but I think they're also tend to perhaps suggest that there will be a lot of things that will be done by less than fully trained surgeons. They will be done more by interventionists, people that know how to run the technology. And it's going to be a challenging thing for every specialty, and particularly, I think it's not just particularly, but I think also plastic surgery.
Bring us through the implant crisis, which some people will see this, and that's old history. They didn't live they weren't in practice between 92 and 2006 when plastic surgeons were vilified, companies were sued into bankruptcy, the whole paradigm changed in plastic surgery. Would you tell us a little bit about that?
Well, I think that the point that they may not find it relevant is probably a little troubling, because the issue occurred as a result of a dysfunctional federal agency, the FDA, and influences particularly special interests that found implants were an attractive thing to attack, if you will. It was activist groups that had claimed that their health was physically damaged by an implant, and they didn't require any science or any studies to prove it. They just had to say it. And it influenced the FDA to take inappropriate actions, the moratorium and otherwise, without having legitimate justification for doing so. Now, if they say, well, that's old history, that's something that can happen again with any sort of area. Now they're talking about fat grafting, they're having issues with that, and the FDA, there are things that are going to come along that will continue to be potential challenges to the specialty, that we need to go back and say what happened in the past so we might be better prepared to deal with these in the future.
This process is now being run by the media and politicians. We have to get two elements back into it, the patients and scientists. And at this point in time, we want to see the science that tends to back up any position, whatever it is. We want to evaluate it to determine whether it is good or whether it is something that tends to confuse. Now, at this point in time, my greatest concern is that David Kessler, who I know you admire, and I do too, but he's called for a moratorium without providing a reason, a scientific reason for doing so.
Which seems to be against what he said when he was on this show about safety.
Exactly. Silicone is an element that really comes from sand. It's derived from sand.
It's not made from hydrocarbons?
No. No,
so it's,
and that's why it's so non-reactive. Silicone is used.
So is glass made from sand?
Correct. And one of the wonderful things about silicone is that it's used by every surgical specialty in medicine.
Okay.
Identical.
Hold it.
That's important.
Go.
Identical.
That's important. That's an important issue. Everything that we use for implantable devices within the body have been modified from commercially available substances so that it can be used in the body. To make the point that this is used for carburetors and otherwise has no more relevancy than saying I wouldn't want to have a stainless steel plate put to mend a broken bone because it's used in ovens, it's used in automobiles, and it's used in rocket engines. These are things that are very important.
When the breast implant crisis occurred, plastic surgery was totally unprepared to be a player in that particular arena. We're unprepared for it. We were naive. We thought, well, science and truth will win out. And in that situation, all we have to do is to recite this to the proper committees and this will all go away. Did not factor in the plaintiffs' bar, did not factor in the special interests, the protest groups, which are well organized. And all of the other issues, the media was a tremendous driver of the things that went on during the breast implant crisis because it became an attractive story to them. The media doesn't care about truth and science, but if they smell a bureaucracy that isn't functioning properly, or greedy industrialists, or perhaps patients that have been damaged, the media will jump on that, and they don't care much whether it's so or not. They just put that out there to prove that it's illegitimate or not. It's somebody else's issue. That's the way they sell newspapers, and that's the way they get viewerships. And so that was a very, very difficult thing with which to deal with. Now, the problem with plastic surgery during the time is that we were, as surrogates, if you will, we did not have an involvement in the breast implant issue other than we used them as devices. The involvement really was the industry and the FDA. The approval of the breast implant was an industry problem that they had to get through the FDA, just like the pharmaceutical companies get drugs through the FDA. And so it was an issue between the FDA and industry. We had no standing. But because of the peculiarity of the time, these protest groups, which were very well organized, were out there representing themselves as the public, and ergo, there needed to be a voice for women who were very satisfied with implants. There needed to be a voice for a procedure that was proven, and it had been in place for 30 years, and there had not been this scale or suggestion that there were the problems that these people were suggesting there was. And so women that were satisfied with their implants, or women that had a satisfactory results in every way, they don't develop groups, support groups.
Sure.
In fact, many of those don't want to even be identified as having implants. And so it fell to the plastic surgeons to represent, to a degree, those women. The fine line to have to walk is to be able to represent the operation as being an effective operation and a safe operation without it being looking like that we were self-serving. We're doing this for our own economic well-being. Right. We had to continue to say, no, we're speaking for the patients. And that was continually the criticism of the organization. We were naive. We did not expect to have all those things that were going to come into play, to have to take issues with statements that are made on television or in the newspaper, that we stand before committees that were really not examining us, but examining the manufacturers. Those things were totally new ground, and we were not prepared for it, and we were totally not prepared, and it wasn't something that we had ever had any reason to prepare for. Now, since that time, the organization has recognized that this could happen again. Maybe not at that level or to that degree, but certainly we have to have the awareness that we must be prepared if this should occur again. We have got better public relations, we've got better ways to support the things that we do. That was the value out of the breast implant. So anyone that says, well, the silicone isn't relevant, the issue is relevant. The fact that there is the potential for a dysfunctional federal agency that could really interfere with the practice, will be relevant as long as there is a government. And so therein lies, I think, the value of the breast implant issue. It was a wake-up call.
And you were president of the society at
Yes.
that time, because the statement that you guided us through this, it was a turbulent time. And obviously balancing things with the government, which I can't imagine having to work with on a regular basis, and a negative public, and recertifying our credibility in the medical community. You were working with all those at any given day. Yes. There were a lot of balls in the air.
Oh, yes, it was. And I want to very quickly say that I was not anyone that was, I wasn't there as a result of some grand design. It was by serendipity and happenstance, that like it does in organizations where individuals move up the chairs and they finally assume the presidency. It was by coincidence that happened during my year. And so it was not something that I guided them. I did it with the assistance of a lot of other people. I just happened to be the most visible face for the whole thing.
Did you regret being president at that time, or were you happy to do it?
Well,
I know it took a lot of your time. There's
That year
no
was,
doubt.
I've said this before, that year was the longest 5 years of my life. But the fact that it was a challenge, and I was comfortable doing it, and I felt that I was given a huge amount of support from people that were providing me talking points, teaching me how to appear. I got a lot of public speaking training during that period. I'd go to Chicago for a weekend, and they would teach me how to manage hostile questions and so on and so forth. And it was very effective. It helped me a lot. I learned skills that once that year was over, I had never ever had any use for again. But nonetheless, in that situation, I was kind of a product of a very supportive society and a very, very talented group of people that were around me, including the other officers and things like that. That's what made that. If there was any success, it was a shared success.
Tell me about your greatest joy, and that's a Gestalt
Well,
thing.
the
It doesn't
greatest
have to
joy in terms of, and you mentioned that before I got in here, what was my greatest joy? And I can't think of a joy as such, but I have a tremendous amount of satisfaction in having been involved in organized plastic surgery in terms of being able to meet the people that I've been able to meet over the last 30 years, beginning with the Aesthetic Society through the SPRS, the Endowment, all those type of things. The people that I have met, I would not have otherwise met if I just stayed in my my solo practice in Louisville and just attended a few meetings, so on and so forth. I've met some incredibly talented individuals, people that I admire immensely. And they have become, many of them have become friends, good friends. And I look forward to coming to meetings to see these people. This is the greatest joy, if you want, of my practice in terms of how I was involved to the point that I could go so many places. I was able to go all over the country and visit people and be a part of their meetings. That's just something that I think I was very, very fortunate, and that would be the thing that I would regard as the greatest satisfaction.
You have any words of wisdom for present and future generations of plastic surgeons?
I think that the present plastic surgeons, those that are in practice, will have to pay a lot more attention to the changes that are going to occur as what I've already spoken about, and that's technology. I think that the concerns that plastic surgeons have in terms of the incursions into the practice of plastic surgery by people that we don't consider are as well trained or sometimes have no training at all has to be a reality that has to be factored into how are you going to function. To try to educate the public and spend hundreds of thousands of dollars educating the public about what is a board-certified plastic surgeon, unfortunately, you're dealing with a public that doesn't care and that will accept anybody's credentials, whether they're legitimate or not, and that oftentimes do not want anything other than something very simple. It allows people to move, especially facial cosmetic surgery, has allowed people to move into providing treatment for aging that at a very primitive level. Botox is one of those things, and fillers and resurfacing allows a person with very little or no training to move into the beginning stages of a person who is trying to manage aging. Well, they will run out of gas after a while because they're not going to be able to do the surgical procedures. But then there's a next echelon of dermatologists and people like that. They will do a little bit more. Plastic surgeons will always be the ones that produce the Rolls-Royce facelifts, eyelid surgery. That's because it requires skills that these others don't have. But nonetheless, we're not going to be able to monopolize all of the facial cosmetic surgery. There's going to be these inroads constantly.
How about some words of wisdom of retirement? Because you say you have enjoyed your retirement immensely.
I retired going on 14 years. And I think that when you enter a practice, I think the first thing you should do is immediately sit down and say, now, when am I going to retire and how am I going to plan for it? Nobody does that. I didn't do it. But I think that should be the advice to anyone that is starting to practice. You're not going to be very busy, so why don't you spend some time on planning for your retirement? Are you kidding? It's going to be. But that's the time to start. And then determine a date, determine an age or whatever it is, and say, well, that's what it's going to be. Now, that's not etched in stone, but your planning should be such that you are working financially so that when you reach that point, you could comfortably say, yeah, I could retire and still maintain reasonably good self. You'll not have to have nearly the money that you do when you're in practice. But that, in that situation, my point is that then when you get to that age, then you make a choice. It should be all about choice. And the choice is, here I am, but I'm enjoying what I'm doing so much, I'm just going to keep doing it. Or I am going to stop. I'm going to open a different chapter in my life, and I'm prepared to do that. The choice aspect of it is, I have a lot of people say, I couldn't imagine not being doing surgery. And well, that's fine, but I think that there's so much talent in all of the people I know that I've ever met in plastic surgery. For just an example, any one of them could have done other things with their lives. Mm-hmm. And we have chosen not to, but that doesn't mean that there's still not enough life to explore some of the things that you could not do when you were in full-time practice. And to me, that's been the most exciting part of retirement, is I've closed the door, and I'm now able to do so many different things with family, with traveling, with writing, those type of things that it's just, I don't have enough time in my days now to get all the things done that I want to do compared to when I was in full-time practice. It seemed like I had more. So it's an exciting time, but it's not for everyone. So others will feel differently. Be planning to get involved in something that will be so consuming that it will make you forget about plastic surgery. I determined that I was going to buy a boat. When I retired, I did. It was an offshore boat. And I determined to take that boat down from California through the canal, up the East Coast, through the St. Lawrence, through the Great Lakes. Incredibly challenging thing to do, and that consumed me. I had never been offshore in a boat. I had to learn navigation, I had to learn engine maintenance, I had to learn everything that there was. And after 3 months of just working at that out in California before we left, at the end of that 3 months, I didn't even know how to spell plastic surgery. That was incredibly helpful in in my making that transition. And the other thing is that moving from where you are to someplace else, and that's why a lot of people end up retiring into Arizona and Florida. Mm-hmm. But there's another thing about it other than just getting to better weather, or you take yourself away from a community that tends not to want to let you go. And being there, it's always, I've gotten up and gone to the hospital every morning. No, don't be in that place where you even have those thoughts. Go someplace else. Come back and visit, but go someplace else.
You give up your MD and you become a mister.
Yeah. I tell people I was a doctor in my previous life.
Yes.
Yeah.
Okay, final question. This is what you wanted to discuss, was another thing that you're very proud of, is the endowment.
Yeah. I would say that of all of the things in which I've involved in my plastic surgery career, I would count the endowment as the thing that I have the greatest satisfaction. And the endowment was a peculiar thing that occurred, and it was a result of peculiar circumstances more than anything else. We had the breast implant crisis. The whole specialty knew, man, we didn't have studies, we had no research of our own, and we really looked bad in that terms, that we weren't better prepared. Well, there had been efforts to raise research money, foundation money in the past, Plasticos and some of the other things, but they didn't seem to strike a chord or stoke up anybody's imagination. And people gave, but it gave minimal sums. Well, as it turned out, the period after the implant crisis, we looked at it and said, you know, there's a remarkable window here. It's not going to be open very long, but it's open. And what we can take is the fact that we weren't prepared and we had no research, and we can make that something that we can use to appeal to members and say, look, if we need to have that in the future, we need to have money in our foundation so that we can undertake research, we can undertake studies that we were unable to do previously. Some of it because of poor planning, and some of it because we wouldn't have had the money. Mm-hmm. And so that came to fruition in 2 years after I was out of office. And I put together kind of a bizarre campaign idea. Mm-hmm. And I proposed, and this was to the foundation board and to others, I proposed a plan that they took to their consultants, the big money raising consultants. And they said, Cole wants to do this. And they said, oh, this is ridiculous. No, this will never work. This is a bad idea. And they started saying, you need to go to the big contributor and go to the members last. And the board of the foundation board finally said, no, we feel like this might have merit. And so what I did, which is kind of strange, is that I was determined to make this appeal where it did not have any fingerprints of the society or the foundation. This was going to be outside of organized plastic surgery. And what I did is that, and my administrative assistant, the person that took care of me better than anybody else, Linda Aliotto, I said, I want to write personal letters to every plastic surgeon. And I want to make an appeal to them to contribute. I want to do it on my own stationery. Mm-hmm. I want to do it with my own envelopes, my own return address. I want every letter to be individually addressed. I want the letter on the inside to be addressed. I want the pledge sheet to be addressed personally. And then I want to send these out with the Louisville, Kentucky postmark on them, all on the same day. And we had about 3 months to do that. And we budgeted 6 weeks to put these letters together. We bought the first laser printer that we'd ever had in the office. Mm-hmm. She worked there, and we produced almost 4,500 individual letters. And I'd spend at night signing them and making a little note up there. What I wanted to do is make it look as personal as I could, sure, like it came directly from me. And we did that. And 6 weeks before the annual meeting, we sent them all out on the same day. Oh. And the return, if they were going to give a pledge or send a check, that didn't go to the executive office. It was directed to come to my office. And in that situation, we had the idea that maybe people would say, well, he's watching as to who contributes and who not. And I don't know if that happened or not, but we always felt there was a little peer, because I still had I still had some currency at that point in time.
Yeah, sure.
And in that situation, and I thought, well, maybe, and the executive office wanted to send us mailing labels for all of the letters. No, I don't want that. And so Linda, you can have the greatest idea in the world, but if you don't have somebody that's willing to implement it, it ain't going to happen. And so because of perhaps the idea, but mostly because of the fact that she was willing to get this out, it was successful. We sent them out 6 weeks before the annual meeting. By the time we got to the annual meeting, we had $750,000 in pledges and checks.
Because of you?
No, because of the members that were, I think the
but
members.
I'm saying you started the ball.
Yeah, but I think it was an issue that the members saw, yes, that appeals to me. And I think it perhaps the fact that it just wasn't another appeal from the executive office. There was a little bit of a different appeal. It was somebody that they knew. And as a consequence, I think that maybe it was beneficial. And then we got another $750,000 at the meeting. So we raised $1.5 million.
You did pretty good.
Yeah, we did. I thought it was very, very pleased, and I thought the members were just couldn't have been more proud of what they did. It was a neat thing, and it's thrived since that time.
I think that comes under Nietzsche's which doesn't kill us makes us stronger.
Yes.
We survived, and we're better for it today.
I like to think so, yes. I know so. I think there's no question that the endowment will be a feature of the specialty for as long as the specialty exists.